for spasticity. And I just want to give this an example, because this is where when we started to see earlier, this is 2011 and 2009, is that in Europe, they actually, there's a drug called Sativex, okay, and then now that's called Epidiolex without the THC for seizures. But in Europe, they've used it for over a decade, very successfully, for treating MS patients. And why I want to stress about this, because even though we don't have Sativex here and we don't need the THC, that's just what was available in Europe, and that's what they just gave as a drug, because it wasn't illegal. They weren't concerned about the THC aspects over there, which here it's more political issue. But one thing to let you know is that when they gave these sprays, okay, it was a spray, sublingually spray, and they had this, 20 to 30% improvement in 4 weeks, which is, again, we don't have a drug that does that for MS spasticity. So these people will have, you can see their arms, their hands, their fingers, their claw-like, their arms clenched, similar to like when people have a stroke, and the neurological changes will cause this kind of spasticity. Is that when they took the drug and they had this improvement, it was 30 milligrams of CBD over that 24-hour period of time. Right? And if you look right now on the internet, people are taking 300 milligrams a day, 1,200 milligrams, 1,000 milligrams 3 times a day, like crazy doses. And but they're always like, oh, I'm getting out of my wheelchair. But when you look at the data, who is getting out of their wheelchair and be able to walk with MS spasticity? They were taking smaller doses. Now, the biggest problem with this product was that also, since it was almost a 1-to-1 ratio of CBD to THC, is that too much THC, then once they got out of the wheelchair, they were dizzy and they couldn't walk too far. So now if we move to a broad spectrum, we could just eliminate this and then just give this, right? So what a wonderful thing that we don't even need a prescription for, and you probably see tons and tons of things. MS neuroacupuncture works phenomenal for MS, so that's one thing I'd also recommend everybody to use. Now, again, real quick, looking at the viral model. So when they give a virus and they stimulate the cells in the animal to mimic an MS, here's before. Here's when they give the virus, it starts to damage, and here's with the virus with the CBD. Look at it, it looks very similar. So you can see here's normal control. Here's when we cause the injury. Here's when you give it the virus with the CBD. So it has a super protective effect. So more importantly, MS is one thing that we misdiagnose for a lot of patients because they have these early symptoms early in college, or it kind of, some people, because there's different types of MS, which you can look up, and some of them present with just kind of minor, I have visual problem, I have a little foot drop, a little balance problem, and then it gets better. And then it flares a little bit later and it gets better. And they can go for years before they're fully diagnosed. What if those patients that we don't even have a full scan yet, or we don't have a full blood test yet, but what if we gave it to them and we can help prevent this progression? So it's pretty interesting that, this is a new group of people that unfortunately we can now target that conventional medicine doesn't have anything. And again, just showing you same thing here, different types of slides of how it prevents the oxidative damage that occurs. So it's almost like the control group, once they give, this beta carotene, this is one of the terpenes that is found in the CBD. Seizures, as you all know, probably most seenly, it's been used for seizures. So I'm going to skip over this in terms of time. But the reason why I use broad spectrum, so there's a lot of people say, like, what about the entourage effect, right? Shouldn't we be using the full spectrum? Now, when it comes to herbs and other things, I do like the entourage effect. And if people want to be using the entourage effect, then I'd say you better be using cannabis that you need to get at the dispensary, because you need to have a certain significant amount of THC to really, truly have the benefit. But what I'm looking at for is not the maximum benefit, but I'm looking at absolutely doing no harm. And when we look at all the studies before it even became an approved FDA drug, of looking at, using THC or just CBD or certain drugs that acted similar to the receptors, the thing that CBD did not have any pro-convulsant effect. What that means is that CBD never triggered in any of the studies more seizures, but when we give THC, it did. Okay, so that's one thing. So even a full spectrum extract can have the potential. Now, it's still low, but the last thing I want to have is any of my patients being treated for some problem and then actually exacerbating that problem. Okay, interactions. This, again, when we think of certain drugs, so you think of diazepam, lorazepam, some of these things. Now, this is in the animal model. In the human studies now, since we have the Epidiolex prescription drug out, we don't really see that as much. Okay, because the doses have to be large doses, and in fact, what we're recommending is actually starting low and going slower. But just letting you know, you should be aware that anybody's taking a seizure medication or antipsychotic medication or anti-anxiety medication, just over time, most likely what we've seen in our clinical practice, my myself personally, is that we end up reducing. So someone's taking, diazepam or lorazepam or, gabapentin, is that we're able to actually turn them down. We're able to actually over time, as we start the CBD, we just go down to, I go down a certain percentage of the prescription drug over time to wean them off. Now, Epidiolex, real quick, just want to explain what Epidiolex so that you understand. Epidiolex is an FDA-approved drug. I'm not here to, I have nothing to do with this pharmaceutical company. However, I just want to explain that because the other aspect of people ask me every day is like, well, I think I need this 0.3% of THC in a full spectrum extract in order for it to work. And in fact, you don't, because that trace is a trace. It's not even 1 or 2 or 3 or 4% that you'd find or higher. Now you're talking about higher doses in cannabis, but even the 6% that was found in the 60s, that would be very beneficial. But when it's traced in our clinical experience, it doesn't have that much of an effect. And in fact, now with Epidiolex, which is just an isolate. So when we think of hemp oil from CBD from hemp oil, remember there's 100 or more of these cannabinoid compounds in hemp oil. What this pharmaceutical company, GW Pharmaceuticals, is they actually just took an isolate. It means one of those molecules, and they've patented it, right? Because they stabilized it and they patented it, and they ran it through the trials. They went through all the trials, and they published the studies, and now it's FDA approved. It's an isolate, so it's not even having all the other terpenes. It's not even having all the other beneficial compounds, and it has 0% THC. So to answer that question, it works perfectly fine. The question is, can we get better benefits using a broad spectrum where we'll have, all these other terpenes, which are smaller compounds than even the CBD that have, beneficial effects. And this also shows that you don't need the THC at all. Okay. And you can see right now what's happening. There's this race of the pharmaceuticals. They have autism, they have schizophrenia, they have glioma tumors. They're all isolating different CBD compounds, and eventually this will be prescribed. So the benefit of pharmaceuticals is that, okay, they do clinical trials, which is helpful. It helps us with data, which we do enjoy. I do enjoy the data because we can understand safety studies and liver studies and toxicity studies, and there's guidance because it can be prescribed by a doctor, which can be helpful sometimes, I think. But the cons is that, the insurance, the cost of this drug is really expensive. Okay. And it's actually several thousand dollars per month. So you want to be, can we provide something that has easy access, that they don't have to have a prescription, they don't have to have insurance. Most of our patients here don't have really good insurance to begin with. So we want to look at that. And also they might be limiting the efficacy, because when we look at studies in Europe, so not the ones that are using the prescription, but like in Israel, in the hospitals, they use like the full spectrums and they use the broad spectrums. I mean, they're using the whole CBD from the hemp and also the cannabis. We do find that it has better aspect because they do have all the other terpene profiles in there. Okay. Also, the cons of this is that they can also have ingredients like propylene glycol and sucralose. Sucralose has been shown to actually create dysfunction to the microbiome. So CBD that's currently available, the pros is that, you can get it. You can get either, again, full spectrum, which is 0.3%, or broad spectrum, which is, 100% free THC. Terpene profiles, what I'll explain is terpenes are smaller compounds. You think of limonene, pinene. There's a variety of terpenes out there. Every food has a terpene almost. Every food almost has like a terpene profile, a terpene compound. CBD has a variety of them, and each of them, some of them have different aspects. That's why different cannabis strains, some of them have more of a, this makes you sleepy, this makes you more energetic, this makes you more relaxed, this makes you more focused. They're smaller compounds. And so these are important things, and we'll probably do another lecture sometime just talking specifically about that. Okay. The cons is that of CBD that right now that's not FDA approved is that you can see is that every week there's another study showing that products are failing. Remember, it's not regulated. Remember, it's not a dietary supplement. It's not a prescription drug. It's kind of like in the middle right now. Okay, and now we're calling it hemp oil. But all these things, you can see that there's contamination, or they don't contain what it says on the label. Everybody right now on the internet, and everybody in America right now can make a product and sell it. And that's why on the internet you can just Google CBD, and you'll probably get like 100 products on that. So that's one thing you want to look at, okay? You want to look at potency, purity, safety, efficacy. That's kind of my 4 mantra words when it comes to nutraceuticals. I formulate. We work with clinical trials with companies. So the key is always making sure that, does the label say? And even like your Chinese herbs, you always want to verify. Like, right. There's certain companies that all of you probably say, I get really good results, and some of these other ones that they might get off the internet or might be cheaper, or the questionable sources kind of vary. So the biggest challenge right now for all hemp is that there's really no federal or state guidelines. And so when they say like there's no guidelines on what to use, in terms of solvents or chemicals. So there's no guidelines saying don't put Roundup or chemicals. And now we look at, there's up to 300 pesticides and herbicides that are being used, on these products. There's also a couple hundred synthetic cannabinoids that have been found in adulteration. We can talk about that later. And then so even at dispensaries right now, there's not even any guidelines on like hand washing. So when you're getting products, you want to make sure GMP and certain things are there. So certified GMP manufacturing. You want to be able to see a certificate of analysis. You want to look at the potency, purity. You want to make sure there's no heavy metals, none of the 200 pesticides, herbicides, and 300 synthetic adulterants. So recently, last year, there was some cases that people were using what they called spiked weed, and there's about 40 to 50 deaths that occurred, and it's because they had adulterants that would look like CBD under the testing monograph, the little GC spectrometry, but the problem is it was actually like coumadin type molecules and they bled. So you want to make sure that sometimes, like, how come it's so cheap? You'll see like some things like, God, it's like 1/10 the price. How does that work? Because it's probably adulterated. Okay, so you got to be careful. Also, molds and microbes are also key, because remember, these are plant extracts, and again, people are not storing these things correctly, especially when they mass produce, mass sell. I like the broad spectrum. That's my personal preference. It does include CBD. It does include the other terpenes, and I just use it for better compliance and ensuring that people have no risk of failing drug testing, because we're not giving them. Now, if they're smoking or doing something else, then that's their issue. That's their problem. But when I'm recommending something in my office, I have to make sure that I'm compliant and also not causing any problems. Some people still have a fear. Now, some people, again, that have MTHFR issues, fatty liver issues, who are just sensitive patients. I have about 30% of my practice is super sensitive patients. Even when I used to have full spectrum, they would complain, oh, it made me feel this, it made me feel that. So I just said, let me just not deal with that issue at all. Okay. So just real quick, I have 1 more minute left. So I want to just sit here and say, start low, go slow. So I have people usually take, we usually come in tinctures, half a drop to a dropper, keep it in the mouth. I like to do it 3 times a day and at bedtime. So smaller, more frequent, lower doses work better than just one larger dose at one time. Okay. And you can start with, 10 to 12 milligrams per dose. Capsules are usually about 7 to 10 milligrams, and again, give it about 10 days or so, a week. So then you slowly increase it. So don't think that they're just going to get it in 1 or 2 days and you're just going to jump and notice the effects. Some people will notice immediately. They have better sleep, they have better pain reduction, but to really get the immune system, remember, we're talking about immune system repairing itself. We're talking about down-regulating, inflammatory markers. It's not a drug where we're just blocking the symptoms. We're actually talking about healing. And so the benefit of this is that I would just want to pull up there was an article just real quick. It came out just this week at Mount Sinai that was published, and they were talking about CBD effective in treating heroin and opioid addiction. So because it has, with the anti-inflammatory effect, you're not just getting analgesia, you're getting lowering the inflammation. So remember, pain drugs only opioids only lower the analgesia. They give you the pain feeling that it's lower, but it's not healing. And so this is something that we can actually get people to heal, so that their addiction and the craving of reducing the pain is lesser. Side benefits is that you can get decreased pain and inflammation, improved sleep. Again, take smaller frequent doses, especially for more chronic or severe issues, rather than larger doses. Caution with clobazepam and valproate. Those are the 2 things in the human clinical studies that did show it does bump up. So there's actually 2 drugs specifically. So if your patient's taking these things, that actually can bump up the potency of those. It is contraindicated in pregnancy, so do not ever give a hemp oil product or a cannabis product for pregnancy, because we're talking about stimulating the immune system of these repairing cells. You don't want to do it. But it may be, now I'm saying with caution because we don't have data, but actually breast milk is the largest amount of anandamide that is passed from mother to child in the aminotransfer of the system of being healthy. So I would say it's less worrisome, but I would still only give broad spectrum because I don't want even a trace amount of THC to a newborn child. Again, putting a patient on a whole food plant-based diet, avoiding food allergies, fixing their microbiome, and using other natural synergistic compounds of anti-inflammatories is wonderfully helpful to improve the benefits of CBD.